So I see it's 1 o'clock. We're going to start this webinar. Hi, my name is Natalie and I work for the Better Project. It's nice to have you with us today to discuss T1D at school. As I know myself, it can be stressful, especially after a T1D diagnosis, to send your T1D child to school. How will their diabetes be managed and what supplies should you leave at school? What are your child's rights? What is your role as a parent? We are going to debunk some of those questions for you today with Dr. Dre Simoneau-Roy. So she has graduated from medical school in 1996 at the University of Sherbrooke and then specialized in pediatrics at the University of Sherbrooke in 2000 and pediatric endocrinology at CHU Saint-Justine in 2002. She subsequently completed a clinical research training program at the Sick Children's Hospital in Toronto. Her research focused on appetite regulation and insulin resistance in children with hypothalamic obesity. She has worked as a pediatric endocrinologist at CHU Estrie since 2005 and has been an associate professor since 2009 at the Faculty of Medicine and Health Sciences at the University of Sherbrooke. She also served as the head of endocrinology department in the Department of Pediatrics from 2011 to 2019. In 2014, she also obtained a graduate certificate in performance management applied to health system. She actively collaborates on various clinical research projects in obesity, metabolic syndrome, and pediatric type 1 and type 2 diabetes. So that is a great resume. So I'm thrilled to have you with us today, Dr. Simoneau-Roy. So I guess you can start, and if you have anything to add to your presentation, just go ahead.
Perfect. So I'm a French Canadian, and I work essentially in French. So please excuse my English. I will do my best. I'm basically a clinician, and I do few collaborative research. So my conflict of interest, it's mainly that I participate in few advisory board for Dexcom, Abbott, Novo Nordisk, Sanofi, and Rhythm, mainly on type 1 diabetes and obesity in children. And I'm also a member of an advisory committee for the LINES in pediatric obesity. And I did few medical expertise for LINES over the last few years. So the presentation, we decided to divide it in 3 blocks. So the first block will be to revise with you and understand the regulations surrounding diabetes in school and define the roles and responsibilities of each person at school, parents, school board, and the student, the nurse, the school nurse also. The second part will be to review the composition of student individual care plan, what they used to call ICP in English with the acronym. And the last part will be to learn about the rights and accommodations available for students with type 1 diabetes according to what it stipulates in the law. Pardon. So type 1 diabetes, as you know, usually appears in pediatric age group. We have in Canada, as in other parts of the world, the annual incidence of diabetes is steadily increasing, mainly in less than 5 years old children. So we will see over the next few years a lot of children that have already type 1 diabetes going to school. So type 1 diabetes is one of the most chronic disease in children that we see, and the prevalence, it's about 1 in 300 children attending school. So most schools will likely have at least one student with diabetes at any given time. These children will spend more than 30 hours per week at school. So it's a lot of time spent outside their home. So they will need to have supportive staff and other student and also a teacher at school to let them develop properly in school. The optimal management of diabetes in school setting is necessary to promote the child's learning. So first part, we'll discuss about diabetes regulations in school. So the diabetes in school is the subject of two very different ministries, mainly the Ministry of Health, who has the mandate to watch over the health of the child, and the Ministry of Education that must create a winning conditions for all students for academic success. So we have a national rule of care since 2022 that defines the minimal guidelines for clinical supervision when care activities take place at school, so outside home with non-healthcare professionals. In Quebec, it will stipulate that parents are the primary responsible for administering care and medication to their child under the age of 14, including insulin. This national rule allows non-healthcare professionals in clinical setting to prescribe, ready to administer medication, including mainly glucagon, and we'll discuss about the insulin a bit. And the school nurse is not responsible to give the insulin, which means that she could supervise, but basically with that law, she don't have any obligation to find someone to give the insulin. So the school nurse will be mainly a transition contact person responsible for monitoring the child's diabetes at school and doing the contact and communicate with the children and the team caregiver. So also, according to the section 39.8 of the professional code, non-health professional school staff may administer, prescribe, and ready to administer care and medication such as glucagon and insulin, but it's basically on a voluntary basis that school staff member will administer insulin. It's mainly and supervise the child blood glucose measure. So at each time of the day, the parents must be available to be reached, mainly if the child's condition become unstable. And basically, and for sure, the school community remain responsible for ensuring the safety at school of each student, including patient with type 1 diabetes. So in Quebec, we have a protocol for school-based intervention that it's a bit, that date a bit late since 2011. It was written by the Ministry of Health and Social Working, donc le ministère de la Santé et des Services sociaux. It will describe the role and responsibilities of each part, and that protocol followed Diabetes Canadian's guideline for the care of students living with diabetes at school. So it's a big protocol, but it could be used mainly for from the school direction and administration, and also the parent could download it and just bring it to open the discussion with the school. So this is for Quebec. In the other province and all the other territory in Canada, everyone since education, it's a provincial jurisdiction, juridiction provinciale. So you can see here that for all province, you will be able to download and have a look to each policies. So it's well documented on the website for diabetes at school that you can see here. So I invite you to have a look for each province where you are, to have a look for Quebec, but also in Ontario or anywhere else. So let's talk about the role and responsibilities for each part. We'll begin with the part, the responsibility for the parents. So the parent, they have the responsibility to communicate with the school administration to discuss any special needs for their children, including if their children has type 1 diabetes. They will have the role also to review the individual care plan with the school nurse. They have the responsibility to provide emergency kits, including the glucagon in the original container with the pharmacy label that contain the student or the child's name. They will need to replace it, anything that will be used or expire. The parents will ensure that their child has a sufficient amount of insulin for the day, either if they have insulin at lunchtime with a pen or with a pump, so enough insulin in the reservoir of the pump. The parents will provide meals and snacks that are appropriate for the child's need and level of activity. They will also provide the calculation for carb content. So we don't expect the staff at lunchtime to be able to calculate the carb content. So most of our parents will just put some Post-it on each thing that will be in the lunchbox. So that will help the staff at school to make sure that if the child is on pump, to be able to calculate very rapidly and with him how many carbs he will eat at lunch. And the parents will notify the school of any change that could affect their child's health, any prescription or anything that was prescribed by the medical team. For the school administration, so their responsibility will be to ensure that students with diabetes are properly identified. They will, in collaboration with the school nurse, they will ensure that the development of the ICP will be done properly, and they will oversee the implementation of the recommendation, including displaying the plan in few places in the school, either at the cafeteria or in the I don't know, the gym or whatever the student go. They will be able to identify people who accept the responsibility for caring for students with type 1 diabetes. Usually it's at least 2 personnel that will be identified for as soon as there is more than 1 patient with type 1 diabetes in the school. They will ensure that all staff have received information relevant to the safe management of diabetes. This will be provided with the collaboration of the nurse. They will provide a safe space also to store the medication, store the emergency kit, the blood sugar testing if needed, and also have a place for the medical waste equipment, which usually will be available for the student, whatever they need. They will also provide the school board with the name and contact information of the student with diabetes as soon as they use the school transportation. They will for sure encourage and ensure that the school staff will promote the participation of all the students in every physical activity, any special events that will take place at school. And they will eventually ensure the transfer of the student's file when changing school or moving from primary school to high school. Another responsibility from the school administration will be to allow the student to use his cell phone in class if it's needed for the reading of the blood sugar using the CGMS. And that could be in collaboration with the teacher. So let's say that the student could left the phone in the teacher's desk or whatever, but just find a way that the student will be able to have his reader around and not annoying all the other student around, and also just make sure that in class they will use it just for blood sugar level. They will also, so the school administration will make sure that the student has sufficient time to eat all his lunch and make sure that he will have all the carbs that he needs. They will allow the child to consume foods containing fast sugar if necessary. So maybe in the class, make sure that they have a snack if they feel in the low and they have an hypoglycemia. They will make sure that the bus school in who there is a student, they will inform the drivers of the right of the students, so using the cell phone and have a snack during the bus trip if needed, and also make sure that the school bus driver know the plan in case of emergency, mainly if the student has an hypoglycemia during the ride. Also, the school administration will be, we just want them to remind that they need to avoid any judgment of the result of the blood sugar test, and don't make a guilt-inducing comment related to it, because it's not really so the parents and the clinical care team will take care of that. So they just need to make sure that the blood sugar is done, but please don't judge any result. And we encourage them, to make sure that no one will change the school snack or what they were supposed to eat. Sorry, I'll just go back. Though we don't want school to take any initiative to change the content of a meal or a snack. For the school nurse, which is really the one that will do the transmission between the school and the family and the clinical team, she will be the one responsible to develop the individual care plan in collaboration with the parents and the children, the student. She will obtain written authorization for that individual care plan. She will be the one responsible to transmit the information to the school principal and all the staff around the children, the student. She will be also responsible to post a list of all children with diabetes and the appropriate places, as we discussed previously. She will be responsible to get a bit more involved in any problematic situation related to any patient with type 1 diabetes as any other children who has a chronic disease, and to report it to the caregiver and discuss with them if we need to change any intervention. So we want the school nurse to collaborate with parents and also try to progressively increase and promote the students' responsibility for their health. She will be, at the end, responsible for the availability of the emergency kit and glucagon and make sure that it's not expired. So according to that, she overall raised awareness among school staff about diabetes, support a good environment for any children with type 1, including going to any extracurricular activity and participate in any physical activity and any special day. And she will be the one responsible to provide annual training for any staff, at least 2 members of the staff, that will be a bit more responsible to provide the care for the students. And that teaching every year will discuss the role and responsibility of each part. She will revise signs and symptoms of hypoglycemia and hyperglycemia. She needs to discuss prevention and treatment of hypoglycemia. She will revise briefly the different modes of insulin injection mechanisms and basic pump info. She will revise also the different devices that we have to check the blood sugar, the Freestyle, the Dexcom, and the fingerprint for us, a few of them. She will for sure revise the glucagon injection protocol, and also just why we do that and what we do after protocol injection, so the mechanisms. For the other school staff in general, We assume that they will collaborate with the school principal, the nurse, and the parents, that they will know and apply the individual care plan. They will supervise, some of them, the blood sugar testing and sometimes insulin administration, either by pen or pump. We assume that they will be able to intervene rapidly if there is any sign of hypoglycemia or hyperglycemia in the student with type 1. They will, for sure, let's say at the service de garde, in the afternoon, they will encourage the children to just express their feelings if they feel discomfort, if they have symptoms or of hypo or hyper, and also that they will accompany them. They will inform the parents about any organization of special day, special trip, special party in the school, in their class. They will ensure the transmission of any intervention that was carried out in the school, so maybe with the logbook or the agenda of the children, to make sure that there is not like one mistake or one hypoglycemia that come back every time after gym, let's say. And they will recognize any situation where they need to notify the parents, and they will check with the nurse periodically to make sure that the emergency kit is okay and there is nothing missing. The student himself has few responsibility. We assume that they will recognize their signs and symptoms of hypoglycemia and hyperglycemia, but as soon as they don't feel well, they will quickly inform the staff member of unusual symptoms, that they will have necessary equipment nearby to take care of their hypoglycemia, that they will follow the instruction according to their plan. They will take care and increase their responsibility that they have managing their diabetes. We also just want to make sure that according to the rules in school in general, that they will not share any snacks, lunch or drink, and they will notify also the parents if anything needs to be replaced in their emergency kit. So it's basically a very, very well partnership that we want to institute in the school with the nurse, all the staff, the administration, the care team, so the team, the diabetes team, and the parents, with the children in the middle of all that will take more and more responsibility with age. So everything that I discussed, it's also similar in few other countries. So here you could find a lot of information on the International Diabetes Federation organization. You can see the website, and it's basically there's a lot of tools that could be used for school. It's a very big document, the toolkit on diabetes in school on that website, but you can download it in many languages, so it could be very helpful. And it was also recommended or approved by the ISPAD and l'Association Canadienne du Diabète, so the CDA, sorry. So this is few things that could be used according to the responsibility of each part. So the parent, the school staff, and the student. It's a very nice protocol or pamphlet that could be used just to open the discussion about what should be done by who and what we want to be discussed. So the second part is to discuss a bit more precisely the personalized or individual care plan for the student with diabetes. So that plan must be developed and agreed with the parent in advance. Usually it's done or pre-filled by the parents, and then when they will meet the school nurse, it will be revised. It must be reviewed and modified as needed. Basically, according to the student need, and at least once a year. The individual care plan will contain a photo, a picture of the student, any resources, discuss about where is the emergency kit, where it should be found, and also what it contains. It could include a typical schedule for the day, and then the blood sugar also, monitoring. So it will contain information about the insulin injection, about the activity before gym, though, so physical activity plan. If the children need a bigger snack, if they have gym just after recess in the morning, so it should be written very precisely in that plan. It will contain a lot of information and also consent to disclose the information among the school staff and the administration, the hospital diabetes team sometimes. It will contain also a consent to treatment signature from the parents or the guardians, and also from the child if possible. It will contain any plan in terms of emergency intervention in case of hypoglycemia, and also what's the intervention plan in case of prolonged hypoglycemia, let's say over 15 or whatever. So I think it's important just to remind that it's mainly the medical team that will be responsible to change the insulin. So every decision that are made in clinic to make sure that the diabetes is well controlled will be made by the medical team. So the type of insulin regimen used in school setting must be adapted to the needs, ability, and wishes of the student and the parent, and should not be dictated by the available school resources, which means that we should not decide not to give or to change the insulin regimen at lunchtime just because there is no resources at lunchtime in the school. So this is something very important. And we don't want the parent to compensate for the lack of resources at school and take care of their child medical needs during school hours. So which means that we don't want a parent to need to go to the school at lunchtime to give insulin just because the school is not able to give the resources. So this is really important to make sure that the diabetes will have the best control possible, and not that some children will have less well-controlled diabetes just because their school don't have any resources. So here you can find an example of the individual care plan for students with type 1 diabetes that you can find on the website of School at Diabetes, which contain the identification of the patient, the contact information, the emergency kits and supply, and where it is in the school and what it contains. So you will see it's about 12 pages. I just put the pages that were more relevant for the presentation. But you can see here the plan in case of a mild to moderate low blood sugar, what we assume that the school will take as an intervention, and also just revise what the school should do if there is a severe low blood sugar, including using the nasal glucagon. And I forget it, but on the website of Better, we have also there is some video for staff at school and also parents just to revise how to use the nasal glucagon. Here you can find all the authorization and the consent, including a student signature. So it's kind of a contract that the children will agree to just advise, or if he has low blood sugar symptoms, then he will collaborate according to the individual plan. And this plan should be reviewed annually, which means that if there is not a big difference from year to year, it could just be when it's remain the same, just dated, and make sure that at least once a year, usually it's at the beginning of the year, school nurses will just have a collaboration with parents to make sure that the plan is still the same, or it's still right. So I wanted to just revise with you what could happen in hypoglycemia. So if there is any hypoglycemia at school, in case of suspected or confirmed hypoglycemia, we don't want the student to be left alone until the hypoglycemia is managed and resolved, which means that we cannot let a student alone go at the toilet if he has hypoglycemia. The school will need to maybe call someone or make sure that another student will go with him and see the principal or or the nurse, but never left someone alone in hypoglycemia. There is potential barrier to the safe and effective management of hypoglycemia in schools, which include lack of training for school staff, unexpected period of physical activity or inactivity, changes in meal and snack times, and lack of quick access to a glucometer or other emergency medical supplies, including a source of fast-acting sugar. In hyperglycemia, we expect that the student will be allowed to hydrate with water and may need to go to the bathroom, so have a bathroom pass if needed. And also that no one will take him out of the class or make him run to lower the blood sugar. This is not appropriate. Physical activity, it's important. It will control the blood sugar over time, so it's very important. Children with diabetes should be encouraged to participate in physical activity, be active, and do all regular school activity, including gym, recess, and special day. The adjustment to be made for safety and optimal performance should be clearly described in the management program. So, which means that in the plan, this could be discussed, and the plan could be well done with the physical activity teacher to make sure that the patient will not go in hypo after each class of gym. So this is another example of school emergency kit checklist that could be used, that you can find on the Better website. And I will finish with discussing the rights and accommodation for students with type 1 diabetes. So the student with diabetes have few rights, including the right to safety, the right to support, and the right to inclusion. The right to safety, so the children must be able to check their blood sugar, administer insulin, treat hypoglycemia, or have a snack whatever and wherever they need to. They have the right to prevent hypoglycemia. The student needs to have enough time to finish their snack and meal. The right to support mean, in fact, it's the fact that at least 2 staff members should be trained to provide support. And when the blood sugar levels are high, the student may need to go to the bathroom more often, as we discussed, and this has to be allowed. The right to inclusion, as we also discussed a bit, the student has the right to be included in physical activity and activity in general, special event and extracurricular activity. Some children will need frequent doctor's appointment, and they should not be penalized for that. So they have the right to seek a medical appointment. I want to just discuss you few very good videos that are available on the website of Diabetes at School that revise all the rights and accommodation that students with type 1 diabetes at school have the right to have. So the right to be safe, supported, and include, and all that. So they discuss the safety according to the individual care plan, the staff training, the treatment, and the emergency plan. So it's very well and very short video that could help the staff to understand the reality of type 1 diabetes. The right to support, as we discussed, at least 2 staff should be trained, staff people should be trained, and just revise also that even if the student with type 1 diabetes are older, sometimes they need someone else to give them juice or carbs just because they don't feel well. So we don't want the staff to assume that because they are in the teen years, the 15, 16, whatever, that they don't need any help. And also, as we discussed already, also that the student will need some accommodation, including maybe having snack with them for the exam and have the right to go to the bathroom, have a bathroom pass if needed. The inclusion also, as we discussed, so the student with type 1 diabetes they are fully student, so they have the right to participate in every activity that any other children at school could have. We just want to remind mainly the school staff that hypoglycemia and hyperglycemia could affect the school learning. In hypoglycemia, the hypoglycemia will influence the concentration, cognitive function, and behavior. And after treating in hypoglycemia, the direct effects on cognition functions could take up to 45 minutes to dissipate. So, which means then that after an hypoglycemia, we should give time to the student to recover if they needed, and maybe add more time to finish an exam. In hyperglycemia, the effects of high blood sugar will vary according to one person to another. The hyperglycemia is known to be associated with a slowdown in cognition performance during assessment, which means that the student could make more errors and they could have slower reactions to school activity. So the recommended accommodation for exam, test, and assessment will be the permission to keep an emergency kit containing a blood sugar meter, hypoglycemia treatment, and snacks at their desk if needed, example during an exam. And in case of hypoglycemia, within half an hour before the exam or during the exam, the student should be given additional time to recover if they don't feel well. So there is many resources. The information are widely available on several websites, national one and also international one, as we discussed previously. And most of them are endorsed by the CPS, the CPEG, and Diabetes Canada. I looked to the Diabetes at School, which is a very good, website. contain a lot of very small video, and it's very good for training and resources to help school staff support with children with diabetes. They could be used for by the teacher and all the support staff. And you can have a look also to the Better website. So in conclusion, to make sure that students with type 1 diabetes do well in school, the school staff should understand, prepare, and school staff and parents should understand, prepare, and support those children, which means all the information should be discussed, and there is few things to be done in preparation of going to school, but also in the meantime during the school year, a lot of collaboration between the team, the diabetes team, the school, the parents, the school nurse, and the children should be done. Few very quick thing that school staff should know about type 1 diabetes. Some are old might, but that should be revised, and it could be print and maybe passed through the staff. So children will not outgrow type 1 diabetes. Insulin is not a cure for type 1 diabetes, it's only a treatment. It takes a lot of time and a lot of work to well manage diabetes. It's technology will help, but it's not by its own. So there is people that should use properly the technology, but it's mainly on the children and parent shoulder to have a good control for the diabetes. So it's not automatic. The blood sugar level could change very quickly, mainly according to what the children ate or do as activity. 6, the low blood sugar need immediate attention, as we discussed previously, and hypoglycemia. High blood sugar means extra trip to the bathroom, so we discussed that also. Kids with diabetes can still eat sweet and have special day, but it should be planned ahead with the team and the parents. 9, even students who are independent may need help managing diabetes, mainly in hypoglycemia. And finally, kids with diabetes just want to be like everyone else, every other children. So they just want to play, have fun, learn, and be successful. Any question? This is the end of my presentation, and you will see a lot of reference at the end of the presentation. So I will be very happy to answer any question in the chat if you have.
Thank you very much, Dr. Simoneau-Roy. So yes, if you have any question, please use the Q&A at the bottom of your screen, and we'll try to answer it. What I understand from your presentation is that collaboration is key to for your children to be safe at school with T1D, and I think that's what people should remember. Also, you mentioned a few websites to go check out, to have resources. On the Better website, you can find several blogs, articles, especially one on the individual care plan and another one on the emergency kit. Also, we have videos. The one that you might like to view is the one on nasal glucagon, how to use it properly, and you can share it with the school staff. Maybe it would be a good idea. Also, I think that injecting glucagon is no longer used. Is that right?
Yeah, it will not be available anymore. So what we understand in Sherbrooke, at least, is that for children younger than 4 years old, the parents will need to get the glucagon by the hospital setting, so by the pharmacy of the hospital, because it will not be available anymore on the pharmacie périphérique. So
Okay.
it will be just the glucagon,
Okay,
the nasal, the Baqsimi. Yeah.
Usually it's easier, I think, to use a nasal glucagon anyway. So
Yeah, it's
for
just that
us,
it's over 4 years old.
yeah, it's 4 years
right
old.
now.
Yeah, but for those kids, it's easier for the parents, but mostly for school members and school staff than an injection of glucagon. So that's interesting.
Right.
So I don't see any questions, so I guess everything was clear. So thank you again for your time, for all the info, and I will wish you a very nice rest of the day, depending on where you are in Canada. And well, check out the website. We'll have a next webinar coming up in October. So follow us, Facebook, Instagram, website. And thank you for being here with us. And we'll see you next time. Bye-bye.